Nigeria's economy today, touching base with all you need to know.
Hello and welcome to your favorite program, Nigeria's Economy Today, coming to you from Super Screen Television. I am your anchorman, Tunde Odeyemi, thanking you for finding time to join us on the program. In this episode, we shall be taking a look at COVID-19 and the Nigerian health insurance system. We are also going to take a look at the effect of COVID-19 on job security in Nigeria. And later in the show, we are going to look at value chain in property management in Nigeria. These and many more will come your way after this timeout. COVID-19 is certainly ravaging the entire world. It's causing a lot of disruption and changing the way we do things. Consequent upon which, many people are finding it very difficult even to go to the primary health care for their health care delivery for fear of not contacting the virus, and some for fear of not being tagged as having COVID-19. What can health insurance do differently? To answer this question and lead in the conversation on COVID-19 and health insurance in Nigeria, I have with me here in the studio a chartered insurer, and of course the man that was part of the team that started the first HMO in Nigeria, Mr. Bimbo Banjoko. Mr. Banjoko, you are welcome to the program.
Thank you very much. Thank you for having me.
Thank you, Mr. Banjoko. You are aware that COVID-19 pandemic is an invasion on the global community. Now, how would you assess the activities of those in the value chain of providing health care or health insurance in Nigeria?
Well, first, we would recognize that health insurance has not really taken too much of a ground in Nigeria.
Okay.
Also, it is important to point out that usually pandemics and epidemics are not usually covered by insurance.
Wow.
Which is one of the reasons why you find that even in the United States of America, the governors are asking for the leadership of the federal government, which our own NCDC is performing here. So usually when you have such epidemics and pandemics, you have infectious, specialized medical people who look after this. However, things might have been better in the sense that if we had a veritable healthcare delivery system that is working for the people.
Okay. What you're trying to say now is even with my health insurance, I'm not covered with COVID-19. Had it been government is not taking care of the responsibility?
If government were not taking care of the responsibility, no, you're not covered. Because insurance schemes exclude epidemics, which by extension would exclude pandemics. Epidemics could be described, if you compare it with property insurance, or as what you describe as act of God.
Okay.
Insurance thrives on the basis of estimation of probability of occurrence, which is based on past experiences, for you to be able to determine how much you're going to charge an individual to pay as premium. So there is no track record of cost of treating this particular ailment, in the sense that it's new all over the world, so nobody could have envisaged. And usually in an epidemic, you have a situation where the spread will be very rapid. And most times, such spreads or such catastrophes would usually run insurance organizations bankrupt. That is not to say that in the United States, you don't have insurances that cover acts of nature, because these are annual reoccurrences. So they can put everything to figures. The duty of an insurance scheme is to be able to estimate how much you're going to pay if a loss occurs. So if I don't know how much I'm going to pay if a loss occurs, then it will be extremely difficult for me to provide an insurance for it. Though I am aware by hearsay that some organizations say they are providing cover for pandemics. I would like to see what they are providing, because even to start the first health insurance company in Nigeria, I did a research for a period of 10 years to be able to understand how the healthcare system works for employers and how much they were spending. So that meant a sampling of over 200 companies with their number of the population within that group to be able to determine average spend. In insurance, premium simply means average. So by that average, we can charge 1 million people the same amount, because we know that probably only 10% of the people will fall ill. But for pandemics and epidemics, we don't have any such data. So that is why it will be difficult to provide.
Talking about pandemic.
Yes.
We never can tell when this will end, right?
Definitely.
And people need to take care of themselves.
Yes.
Government is battling with thousands of people now. If government decides to back out, can't an individual take an health insurance that will cover COVID-19?
You may be able to if you find a bold insurer. But the gap would be on what are you basing your expectations. There must be an expectation that maybe out of 5, as at now, for instance, we have about 35,000 people who have been confirmed. And maybe, so the question is that going to be a continuous projection, or is it going to come down? That is dependent on the individuals, not on government. It is a responsibility for individuals, because this is an incidence that you cannot track. We're seated here together. You're not sure if I don't have it. So the problem is ability to calculate the probability of occurrence. So that is what will make it difficult for any insurer to say they want to cover the COVID-19. Because even as it is, the truth is, in my mind, we don't have the proper actuarial valuation for even the health insurances we're doing.
Okay.
Because we have not been able to do proper statistical analysis and claims analysis to have precise morbidity ratios and things like that.
Okay, thank you. From there, it is still COVID-19 and health insurance system in Nigeria. Viewers can join in the conversation by calling on the number that you are seeing on the screen of your television to join our guest in the studio. Mr. Banjoko in discussing COVID-19 and health insurance in Nigeria. Now, Mr. Banjoko, now we know that some people have taken health insurance. Yet, because of this pandemic, and in order to take care of not contacting it, even when they have need to access that insurance, they don't go to the hospital. What can health insurance now do differently in this dispensation to improve on our healthcare delivery system?
It's a two-way thing.
Okay.
Health insurance does not work in isolation. The operations of health insurance depends strictly on healthcare providers. In other words, you would have to also shift attention to the hospitals and to the clinics.
Okay.
Because they deliver care. What an insurer does is to say, maybe in 10 people, one person will be ill. If one person is ill, it will cost X, Y, Z. So I need 5 people to be able to pay for one person. So we need to critically look at our health systems. That is the most fundamental thing. Because the epidemic will pass. We'll have to find a way to manage it, whether by vaccines or whether by keeping safe distances, which is the exact solution for now. If we do those things that have been prescribed by keeping social distancing and the hygiene, significantly, the incidence of COVID-19 will be manageable.
Okay.
So even if we improve the health systems and we don't do those basic things, we're fooling ourselves. For instance, just across the road here in Shomolu, you'll be shocked that nobody is using face masks or whatever. To them, it's like it's still a normal day-to-day life. So if there should be any outbreak there, before you know what is happening, a lot of people will catch it. So it's not a particular function. However, suffice to say that the NCDC and the Nigerian hospitals have done marvelously for the kind of death rate that we have, and for quickly coming out to tell people what to do. And that is probably based on the experience of Lagos State and the Ebola. So they know what it is to have such a dangerous infection. So that has assisted to slow the rate of infections. So for health insurance, every state needs to set up their health insurance scheme. Health starts from the primary healthcare level. And 80% of hospital utilization is at the primary healthcare level. So if all states, for instance, were to set up their health insurance, focus only on primary care, well, primary care would be described as those basic things that you probably could actually even treat at home. I said probably, I didn't say you should.
You need to clear that.
Like malaria, cough, dysentery, diarrhea, toothache, and so on.
Oh, those ones are the ones that you classify as primary health care.
Yes, primary health care. Okay. The day-to-day occurrences. And if every state, as they're doing, will also just take care of pregnant women and children, we would have effectively, if that is done effectively, we would have improved our health indices by 80%. Because the implication of that is that it's only probably 15% of people that would require specialist care. And probably only 2% would need hospitals like the teaching hospitals. But the situation we have now is chaotic. Every state or every person has left healthcare delivery to the federal government, which is not supposed to be. We keep blaming government. We do not do what we are supposed to do. And we also do not ask from our state governments and local governments. Each local government is expected to have primary healthcare centers. So what happens in these primary healthcare centers? And also there's no, some of the significant problems we have with healthcare delivery is administration. How do the local governments or states monitor what is going on are the primary healthcare centers that they own. A lot of them have become rundown. People are paid to work in those places. Those people, if they go to work, really have nothing to do because the people do not have trust in those centers. So, in other words, what you have now in the name of primary healthcare are just mainly structures, except those that are provided by the private hospitals. The private...
Okay, talking about the private hospitals.
Yes.
And the concept of isolation centers now.
Yeah.
And the fact that the government has taken it up. Would you, would you say that the job functions of the healthcare provider have been usurped?
The answer is no, in the sense that even before now, those private centers were there, working side by side with the teaching hospitals, general hospitals, and so on. And it may surprise you that the first person to survive a ventilator in Nigeria happened in a private hospital. And I think it's only within the last few days that one also happened in Lagos State,
okay,
managed by Lagos State. So healthcare delivery is not a one-man function. And you know, there are people who have choices. You either go to government or you go to private. So that's the principle. So it's a collaboration. They are working together. Well, I know one of what might have brought about your question is the fact that if you go to most hospitals now, they don't want to attend to patients.
Sure.
That is what is happening all over the world. If you're not really ill, you are advised not to go into a hospital because of the various types of people that will go there, so you don't know who is infected.
On a final note,
okay.
On a final note, which way forward for the best healthcare system in Nigeria?
The best system is for every state to set up their health insurance agency, and for those health insurance agencies to focus on the basic scheme, which is the primary health care. Let me just give you a statistics.
Okay.
If we assume the population of Lagos State is 20 million, 5% of Lagos State is 1 million people. If you were to charge those 1 million people 5,000 naira only, you would have a portfolio, a bucket of funds worth 5 billion naira. In Lagos State, you probably would not need more than 200 hospitals, which means that whether those hospitals work or not, you have a minimum fund of 20 million per hospital. It may not look much, but you'll be surprised that a lot of hospitals don't make that kind of money. And moreover, when you're running a social health insurance scheme, it may be a misnomer if you are using private healthcare centers to run a social health insurance scheme.
Okay.
So you're supposed to use the government and local government hospitals where the government is already paying the salaries, the government owns the infrastructure. So what the contribution is going to be at the end of the day is running costs and providing those basic needs. Now, if the people under the National Health Insurance Scheme, if anybody should have COVID-19, I believe the national NHIS can pay for it.
Okay.
Because the NHIS has been able to accumulate funds. And they were monitoring to see what claims were coming in, what people were coming up with, and how much they have in their reserves. So recently, with the new executive secretary, the bouquet of benefits has been increased.
Yeah.
So that people can get better benefit. That is how it's supposed to work. You work from the unknown, from where they started. Now they have information. They can now offer XYZ. So yes, the NHIS can cover people with COVID. The private HMOs cannot. Because, like we said, I co-founded the first HMO in Nigeria. The private health insurance portfolio in Nigeria is not a profitable scheme. in the sense that HMOs are left at the vagaries of providers. Also, we run a manual system whereby claims come in 2-3 months after the incidents. So how do you verify? Even in India, they used to have a lot of fraud despite the computerization. So the thing to do is to computerize the healthcare system from beginning to end, from primary healthcare to the health insurance platforms. So as people are going in to receive healthcare, the HMO or NHIS or state health insurance scheme knows and gets a prompt, and your claims are inputted into the system. So when, let's say, malaria is treated, you know that from the computer system, this is how much claim that will be paid.
Thank you very much, Mr. Banjoko, for that, for educating us on health insurance in Nigeria. That is the most we can take from Mr. Bimbo Banjoko. We want to thank you for coming on to the program. Still to come.
Thank you for having me.
Thank you, Mr. Banjoko. Still to come, COVID-19 and the threat to job security in Nigeria. Don't go away, we'll be right back.